Hello, everyone, and welcome to final part 3 of All About EMS training. First of all, we're talking about the PCR, pre-hospital care report. We'll go into further trainings about this, how to write every part of it, but most thing you need to know is what a PCR is. So it is the documentation that you have to give to the hospital and to know that you picked up this patient effectively at what times, what the name of the patient, location, what they presented with, how it happened, what you did for it, vital signs. Tell the whole story. This is your document that tells you what happened. And you can recall what happened if you look at your PCR. It should tell the entire story. Every call must have a PCR, and a PCR is written for all calls, RMAs, even if they went to the hospital, even if you don't even find the patient, you must write that for any even standbys. So even if you didn't find the patient, you write patient was looked for, patient searched for, patient unknown, all it you write, you'll fill in all the boxes. Even for standbys, for events, we'll put standby and we'll fill out the PCR as if it was just a standby. You'll input with black ink, so you use black ink, and it's easy for you to push down all the way and write a little harder so that it goes through to all three carbon copies, write legibly, and use medical abbreviations that we're typically using. Crew chief goes in the in-charge box, driver goes in the driver box, and then tech and riders go into the boxes after that. So from the bottom pink copy, after you have that, rip it off. It's good practice to put one of the stickers that the hospital gives on the pink copy. So rip off one of those stickers that they give the patient, put it on the pink copy, and then you can put it in the drop box. Middle and top, so yellow and white. This is for us. We retain these for some odd years. And you'll either go to Miss Sonia and have her scan it and then put it in the ambulance bay if it's during patent hours, or you can just put it straight in the patent bay. Where to submit the PCRs? Pink copy for the hospital. If in doubt, ask. There's a little drop box that says PCR drop box. Yellow and white go to the ambulance bay. Remember to put the run numbers. Well, we'll go into that later. Confidentiality. So HIPAA. For in any case, make sure you put the patient's PCR face down. This is even when we put it in the ambulance bay. Put it face down. Put it face down in the ambulance bay. Put it face down in the hospital pre-hospital care report by Dropbox. So this is just to protect the wandering eyes. If some guy wants to know what happened, they'll just glance over and see who the name is, what happened, what their social security number is, and all that. So make sure you're protecting your patient by putting your pre-hospital care report face down. See management, HIPAA again. Make sure you're protecting the confidentiality of your patient. Anything they have is not to everyone's knowledge. It is for you as a medical care provider to know, to give them the best medical care provided. So crowd control is another thing. There's too many people in the room. It's really hard to get an assessment of your patient and really talk to your patient and get to know them. So if there's too many people in the room, just say, hey, I need clear space. I need to be one-on-one, or just get everyone out, Help crowd control, supervisor, medical officers. So DPS can help. OIC is a really good resource for this. They can just take everyone out, put them to the side. CDOs. So sometimes you'll deal with a CDO if it's a drunk call or a midshipman with behavioral issues. So if a CDO is nagging you, just say, hey, I am an EMT right now. I'm not a midshipman and I'm doing my duty. I cannot give you this information right now. Even if an MCDO says, hey, I need to know who that was because someone else is wondering, you are by law not required to give them any information on your patient. Just if you feel like, oh, I don't know if I should give this guy the information, or this MCDO, CDO, go with your gut feeling and just say, sorry, ma'am, I can't give you this information. I'm under HIPAA. I'm a medical professional. Commissioned officers, if they confront you, if they harass you, just be respectful and we'll handle if they punish you later. So don't worry about that if they punish you. Accountability check, this for the OIC. So fill out this chit every time, give it to the CDO, DPS, and then we'll keep it for our own records. So DPS, they should show up every call. They are the hot fuzz of USMMA. So if they get in the way, typically they're here to help and kind of just get the story. But you can use them as a resource if you can. If you need to contact them for anything, just call them by phone or just go to the front gate and ask them what you need. Hospital operations. Arriving at the hospital. So if you need to request Medcom, just call them on the Medcom radio. Use the chit that we have, or not the chit, the pony we have in the bus. You can use that as a reference. Bring the patient to North Shore. Wait on the left side for the charge nurse. Do as you normally do. Do not leave the patient alone. So at least have one person on the patient at all times. So you'll typically put a wristband on them, put a sticker on them, and then take them to the areas. So there's a code to get into North Shore. It is 0911 star or 0911 pound. It has that code on there. So just remember it's 911. Make sure the patient's vitals, get the temperature, get the vitals, and then you'll give it to the charge nurse. Typically, you'll also give them the height and weight of the patient. And they'll ask you for the allergies, if they're on any medications, and other questions. So make sure you get that when you get the sample and the OPQRST. But we'll go into that in future trainings. So you'll back in the ambulance, take them out on the stretcher, roll them in here. There's vital signs, kit, temperature, talk to the charge nurse, give them the story. They'll take you to, I've had patients go to the red area or pediatrics. So you'll either go into this area here and there's a door around here, or you'll take them straight to peds. So either of the two is within reason. Transferring patient. So typically it's easy for you guys to do is either do the sheet drag. So put down all the rails, help them, assist them go into the bed. So put the stretcher alongside the bed and sheet drag, or just have the patient kind of scoot their butt across. Get the agency to sign the PCR. So sign the top or the back of the white copy. So that's the front page. And you will be on your merry way. Once you get out, we'll do a resupply, reload, re-engage. So you'll take what you can. I mean, you can be frugal or be selfish. I would say take what you can and don't ask questions. But so if you go in here, this charge triage is around here. There's this area that between the two doors, you can grab a bunch of supplies. So I would do that. Grab linens from the linen cart, disinfect everything you used, and re-linen your stretcher. I would say double linen it. So leave a pink copy for the PCR. For the charge nurse, if in doubt, ask. Get your call numbers from vigilant dispatcher. If you didn't write them down or you're not sure, don't forget or I will find you. I wouldn't worry about Liam Neeson when you have Sam Mills as Resco. So he will find you if you forget. Make sure you give the patient your get-home paperwork, and at the very least, give them the EMS crew chief number just in case finally taxi doesn't pan out. After the call, make sure everyone disinfects. This is especially important during COVID times. Disinfect the stretcher, disinfect all the equipment you used. Make sure everything is sanitized and good to go. For bodily fluids, throw up bodily fluids, poop, anything. Use a bleach solution. Just really disinfect what you got. We clean the bus. And DPS cleans all around campus. So make them clean if someone threw up on Tomb Field or in the barracks or in Bowditch. So give the calls when you're back in service. So MM1 is 18. One important thing for the protocols, I want you guys to know this, just at least this little snippet down here. These protocols are not a substitute for good clinical judgment. This just means your gut feeling that you have. If something in the protocols doesn't feel right, listen to your gut. This is your good clinical judgment speaking. So if something doesn't feel right, listen to your gut. Hot wash. So after most calls or all calls, we review what happened, what went wrong, what could we do better, and how the team can improve. Let the IC know, and then we can maybe spark some future trainings if something went poorly or something went really well that you think you learned from. And I hope everyone is getting after it. Ask for help if you need it. We have our EMS officers, DPS, Medcom, Poison Control, ALS, Vigilant. These are all the numbers. Everything that's starred, I would like you guys to have in your phone at the very least, or you can have all of them. Save lives, hoo-yah, and if you have any questions, I will link the protocols in the email. Thank you for your attention, and I'll see you in future trainings.